This video briefly explains why sociologists and biologists should attempt to understand one another. And this video briefly explains why we see health disparities among individuals. All these health disparities among individuals is due to our genetic makeup, which can in turn affect our allostatic functioning. And sometimes our genetic makeups can lead to allostatic dysregulation. And in fact, our genes, our allostatic functioning, and our health behaviors are often interlinked. And biomarkers related to allostatic load can be found in our blood system, and they also reflect our physiological system. Our physiological system can include reproductive, skeletal, renal, muscular, nervous, endocrine, immune, respiratory, and cardiovascular system. Atherosclerosis pertains to the thickening of blood vessel that carries oxygen to our heart and the rest of our bodies. And the fatty deposits can also clog our arteries. In fact, our external environment can turn certain genes on and off, and this can in turn lead to changes in our phenotypes. In fact, our social environment determines the duration and intensity of our stress. This in turn affects our cortisol levels. And when our cortisol levels are being elevated due to stress, this can affect our estrogen, adrenal glands, and it may overactivate our pituitary glands. And these can lead to a range of health issues like weight gain, thinning of our skin, slow healing of wounds, weakened muscle strength, headache, high blood pressure, osteoporosis, low ability to absorb calcium, fat accumulation in certain parts of our face and shoulders. Okay, so why neighborhoods are different from one another? Our external environment can affect how family functions in a neighborhood. In fact, the neighborhood or external environment always interacts with the family that resides within the neighborhood. And this in turn is going to affect the allostatic loads of the individuals living in this household and family. And the level of a person's allostatic load is going to affect a person's ability to handle stress. And this in turn affects a person's mental health or a person's risk for all these illnesses like hypertension, obesity, atherosclerosis, and so on. So this explains why there is health disparities across neighborhoods. So sometimes maternal stress, the stress of the mother when she was pregnant, may be due to the stresses associated with her neighborhood. Maybe certain characteristics of her neighborhood, or family-related stresses, job-related stresses, other kinds of stresses in the mother's personal life. Can these regulate the cortisol levels in the utero? And this can lead to accumulation of stress from our infanthood to our old age years. The stress while we were in our mother's womb can in fact accumulate, and researchers have confirmed that. And this accumulation of stress often progress from our infanthood to childhood, to teenage years, to adulthood, to old age. And this in turn is going to affect our ability to process information, which in turn affects our academic performance and health outcomes. And this in turn affects all kinds of outcomes during our adult years and old age.